All right, let's dive in. Today we're tackling two meds, clopidogrel and cilostazol. We'll figure out how they work, what they're for, and what to watch out for. Sound good?
Sounds like a plan. It's fascinating how these two approach similar problems in totally different ways.
Right, it's like two roads leading to the same destination. So first up, clopidogrel. It's an antiplatelet med, which means it helps prevent blood clots.
Exactly.
But it seems especially important for people who have heart disease or have had a stroke, or even those dealing with peripheral artery disease.
You got it. Preventing those clots is super important for all of those conditions. The interesting thing about clopidogrel is how it works. It targets a very specific spot on platelets, those tiny cells in your blood that cause clotting. It blocks something called the P2Y12 receptor.
Okay, the P2Y12 receptor. I'm going to need a little more explanation on that one.
Okay, so imagine you get a cut and platelets in your blood rush to the scene, right? They need to stick together to form a clot and stop the bleeding. The P2Y12 receptor is basically like a doorway on these platelets.
Okay, I'm following so far. The P2Y12 receptor is a doorway. What happens next?
Well, there's this molecule called adenosine diphosphate, ADP for short. When ADP binds to that doorway, it's like a signal flare going off. It tells all the platelets, hey, get sticky, time to clot.
So clopidogrel is like that bouncer at the doorway saying, nope, not tonight, party's over. It stops the platelets from sticking together too much. I like that analogy.
Exactly. And by blocking that specific doorway, clopidogrel is really effective at preventing clots from forming in your arteries.
That makes sense. So how do you actually take this clopidogrel?
Easy peasy. You just take it orally once a day. With or without food, doesn't really matter.
Sounds simple enough, but I know all meds come with potential side effects. What should people be aware of with this one?
The most common ones are pretty straightforward. Bleeding, easy bruising, and sometimes some gastrointestinal upset.
So I guess you should stock up on Band-Aids and be careful with sharp objects, but are there any side effects that are more serious?
There are a few, but thankfully they're less common. The big one is a severe allergic reaction. Think trouble breathing, a racing heart, a skin rash, swelling. The works. If that happens, stop taking the medication and call your doctor immediately.
Okay, so more than just a little bump or bruise. Got it. Anything else to keep in mind?
Well, there's this very rare but life-threatening side effect called thrombotic thrombocytopenic purpura, or TTP.
TTP. Doesn't sound good.
Not really. In TTP, blood clots form in these tiny blood vessels throughout your body. If it's not treated right away, it can be fatal.
Oh, wow. What should people look out for?
Unexplained bruising or bleeding, tiny purple spots on the skin, any weird neurological changes like confusion or seizures, anything like that.
So bottom line, if you notice any of those serious side effects, stop taking clopidogrel immediately and call your doctor.
Couldn't have said it better myself. Early intervention is key in those cases.
All right, so clopidogrel is all about preventing those clots. But what about when you already have poor blood flow? That's where cilostazol comes in, right?
You're on a roll. Cilostazol is kind of a multitasker. It works as both a phosphodiesterase III inhibitor and a vasodilator.
Okay, maybe break those down for me a little bit.
Absolutely. So cilostazol is mainly used to treat something called intermittent claudication.
Intermittent. What was that again?
It's basically leg pain due to poor blood flow. It often happens with peripheral artery disease. Imagine your arteries are like highways, and with PD, you have a traffic jam. Blood can't reach your legs efficiently. That's what causes the pain, especially when you're walking.
Got it, the clogged artery highway. So how does cilostazol clear up that traffic jam?
Well, it attacks it from two angles.
Okay.
First, it widens those blood vessels, like adding extra lanes to that highway. Second, it also inhibits platelet clumping, kind of like clopidogrel. That helps improve blood flow even more.
So it's like cilostazol is widening the roads, A&D, making sure no accidents happen to slow things down even more.
Exactly.
Gotcha. Now, how often do you take cilostazol?
It's twice a day, usually 30 minutes before or 2 hours after meals. Important timing to remember.
Twice a day. Strategic timing with meals. Okay, got it. What about side effects for this one?
Well, like any medication, it has its own set. The common ones are headache, diarrhea, dizziness, and palpitations.
So maybe keep some water and pain reliever handy with this one. Makes sense. Are there any serious side effects to watch out for?
The serious ones with cilostazol would be severe bleeding, irregular heartbeats, and sudden drops in blood pressure.
Okay, so it definitely sounds like staying in close contact with your doctor is key while taking either of these.
Absolutely. Regular monitoring is so important. Always report any unusual symptoms to your healthcare provider, even if you think it might be nothing.
Right, because speaking of navigating, we need to talk about interactions, like how these medications might interact with other medications or substances.
Ah, yes. It's like a medication mixer. We got to make sure everyone plays nicely together.
Right. So, what are some of the key interactions to watch out for? Give me the scoop.
With clopidogrel, you got to be really careful if you're also taking blood thinners like warfarin, NSAIDs, which are common pain relievers like ibuprofen or certain antidepressants. Those combos can really increase your risk of bleeding.
And I'm guessing alcohol is probably a no-no with these meds too, right?
You got it. Too much alcohol can definitely increase your bleeding risk with both of these.
Duly noted. What about cilostazol? Any red flags there?
Cilostazol can also interact with blood thinners and certain antibiotics like clarithromycin and some antifungal medications.
Oh.
Ooh, and this one might surprise you. Grapefruit juice. You should avoid that with cilostazol.
Wait, grapefruit juice? Seriously, why grapefruit juice?
It's pretty interesting, actually. Grapefruit juice has these compounds that can interfere with how your body breaks down certain meds.
Ah, so it messes with the processing of the medication.
Yeah, and in cilostazol's case, that can cause the levels of the drug in your bloodstream to go up, which can make side effects more likely.
Wow, you learn something new every day. See, this is why I love these deep dives.
Me too. Knowledge is power, right? The more you understand about your medications, the better equipped you are to be a partner in your own healthcare.
I love that. Taking charge of your health is so important. Well, it seems like we've covered a lot of ground with these two medications, from how they work at the cellular level to their uses, potential side effects, and even those tricky interactions.
We have. It's amazing how small differences in a medication's mechanism of action can have such big impacts on how they're used and what to consider.
So true. It makes you realize how complex the human body really is.
Absolutely. And there's always more to learn.
Okay, so we've laid the foundation, but there's a lot more to explore these medications. We've got to figure out how they're used in specific situations and answer the question on everyone's mind. Which one is the better choice for different scenarios? So much more to unpack.
I'm ready when you are. Let's keep diving in.
All right, welcome back to our deep dive into clopidogrel and cilostazol. We've got the basics down, but now let's get into the nitty-gritty. How are these medications actually used in different situations?
Great question. Let's start by revisiting clopidogrel. Remember, it's all about preventing those blood clots.
Right, and we talked about how it's often given to people after a heart attack or stroke to prevent another one from happening.
Exactly. Think of it as a safeguard, helping to reduce the risk of future cardiovascular problems. And it's also a key player in managing peripheral artery disease, or PAD for short.
Ah, yes, PAD, those clogged arteries we talked about.
Precisely. And here's something interesting. Sometimes clopidogrel is even used along with aspirin for some patients. It's like a 1-2 punch to keep those arteries clear.
A double dose of clot-busting power. But wouldn't combining medications like that increase the risk of side effects? Like, wouldn't you be more likely to bleed?
That's a really good point, and definitely something doctors consider carefully. It's all about weighing the potential benefits against the potential risks. It's a balancing act for sure.
Makes sense. So there's no one-size-fits-all approach here.
Exactly. Every patient is unique, and the treatment needs to be tailored to their individual situation. That's the beauty of personalized medicine.
Absolutely. Okay, so now let's shift gears to cilostazol. We talked about how it helps with intermittent claudication, that leg pain that happens because of poor blood flow.
Yes, and cilostazol is a real workhorse when it comes to treating that condition. Remember that analogy we used earlier about the clogged highway?
Oh yeah, the blood vessels as traffic-jammed highways.
Well, cilostazol not only helps widen those blood vessels, but it also helps prevent further blockages. It's like adding extra lanes, A&D, making sure there are no accidents to slow things down.
I love those analogies. They really paint a picture. So how effective is cilostazol at relieving that leg pain? Does it completely get rid of it?
It's not a cure for PA, but it can make a huge difference in terms of symptoms and quality of life. There are studies that show cilostazol can actually increase the distance people with intermittent claudication can walk before the pain starts.
Wow, that's incredible. It's like giving people their mobility and freedom back. I bet that has a big impact on their mental well-being, too.
You're so right. Being able to move freely without constant pain is so important for our overall well-being. It's not just about treating the physical condition, it's about treating the whole person.
That's such an important point. It's about improving someone's overall quality of life.
Okay, so now I'm curious, are there any times when one of these medications might be preferred over the other? Like, have there been any studies comparing them head to head?
That's a fantastic question and something researchers have looked into. When it comes to preventing another heart attack or stroke, especially in people with PID, studies suggest that clopidogrel might be slightly more effective.
So clopidogrel might have a slight edge in preventing those really serious events.
Yeah, but if the goal is to improve walking distance and reduce that leg pain from intermittent claudication, cilostazol often comes out on top.
Ah, so it's about choosing the right tool for the job. It all depends on what you're trying to achieve.
Exactly. That's why it's so important to talk openly and honestly with your doctor. They can help you figure out the best option for your specific situation. That brings up another important point, patient education. If you're prescribed either of these meds, what are some key things you should chat with your doctor about?
Being an informed patient is so important. First off, be totally honest with your doctor about every medication you're taking, prescription meds, over-the-counter stuff, vitamins, herbal supplements, everything. Remember all those tricky interactions we talked about? Your doctor needs the full picture to make sure everything is safe for you.
Right, no medication is an island. What else should people be aware of?
It's also important to talk about your lifestyle. Things like how much alcohol you drink, whether you smoke, in your diet, all can play a role in how effective and safe medication is going to be.
So it's all about being open and honest with your healthcare team.
Absolutely. Don't forget, you're a partner in your own health journey. The more you know, the more empowered you are to make decisions alongside your doctor.
I love that. Empowerment through knowledge.
Yeah.
Okay, so we've talked about how these medications are used, the potential side effects, those tricky interactions, and even some head-to-head comparisons. But there's one more piece of the puzzle we need to discuss, the importance of monitoring.
You're right. Monitoring is key with both of these medications.
So what does monitoring actually look like? What should people expect?
Well, it really depends on your individual situation and why you're taking the medication. But generally speaking, you'll probably have regular checkups with your doctor to see how things are going, check for any side effects, and adjust the dosage if needed.
So it's not a set it and forget it kind of thing.
Nope, it's more of an ongoing process, kind of like a regular tune-up for your health. And remember those side effects we talked about. Don't hesitate to call your doctor right away if you notice anything unusual, especially any signs of bleeding or bruising. It's always better to be safe than sorry.
Absolutely. So to sum it all up, both clopidogrel and cilostazol can be really powerful tools for managing certain heart conditions. But it's super important to understand how they work, the potential benefits and risks, and why ongoing monitoring is so important.
Well said. Now remember, this deep dive is just a starting point. If you're prescribed either of these medications, keep asking questions, do your own research, and above all, work closely with your healthcare provider to make sure you're getting the best possible care.
I love that. Empowering patients through knowledge and collaboration. Well, we've covered a ton of information today, but before we wrap up this episode, let's take a quick breather and come back for one final part. We'll touch on a few extra things to consider and leave you with some food for thought. And we're back. We're in the home stretch of our deep dive into clopidogrel and cilostazol. We've covered a lot, but I feel like there are always a few more things, right, before we officially wrap up.
Oh, absolutely. There are some really practical things to think about. Like both of these medications, they can take a while to really kick in.
So you don't necessarily feel the benefits right away.
Not always, no.
Yeah.
It's kind of like, planting a garden. You plant the seed, but it takes time for it to sprout and grow.
I like that. Patience is key.
Exactly. Don't get discouraged if you don't feel a difference immediately. Just stick with the plan your doctor gave you.
Okay, that makes sense. So what happens if someone needs to stop taking one of these meds for whatever reason? Can they just, stop cold turkey?
That's a good question, and generally the answer is no. You really shouldn't stop clopidogrel or cilostazol without talking to your doctor first.
So it's not like just hitting a pause button.
Right. It's more like, how can I explain this? It's more like using a dimmer switch. If you need to stop, you have to gradually taper off the medication. Your doctor will help you do it safely.
Gotcha. Teamwork makes the dream work. Now, I know cost is a big concern for lots of people, especially with prescription meds. These aren't exactly cheap, are they? Are there any ways to make them more affordable?
There are definitely some things you can try. The first thing is to check with your insurance company. Find out what your plan covers. You might find that one medication is covered better than the other,
That's a good point. So checking with your insurance is step one. What else can people do?
Don't be afraid to ask your doctor about generic versions. Generics often have the same active ingredients as the brand name drugs, but they can cost way less.
Generics are great, especially if you're going to be on medication for a long time.
Exactly. Oh, and one more thing. Shop around. Believe it or not, prices can vary a lot from one pharmacy to the next.
Really? So it pays to do your research.
It really does. You could save a lot of money just by making a few phone calls or checking prices online.
Those are some great tips. I love it when we can empower our listeners with practical information like that. So before we officially say goodbye, I want to circle back to something we touched on earlier. Remember how we talked about the impact these medications can have on a person's life? I mean, beyond just the physical stuff.
Oh, for sure. Medications are about so much more than just treating symptoms, right? They can really make a difference in how you feel and how you live your life.
Right. For someone who's struggling with leg pain from intermittent claudication, cilostazol can be life-changing. I mean, if you can suddenly walk without pain and do the things you enjoy, that's huge.
Absolutely. It gives people back their independence. And for someone who's had a heart attack or a stroke, taking Clopidogrel can give them peace of mind, knowing that they're doing everything they can to prevent another one from happening.
It's all about feeling empowered and taking control of your health.
Yes, exactly.
Well, I think we've explored every nook and cranny of clopidogrel and cilostazol, from how they work at the tiniest level to the big picture impact on a person's life. We've covered it all.
We've been on quite a journey.
We have, but this is really just the beginning. Keep learning, keep asking questions, and keep talking to your doctor. That's how you stay healthy and informed.
I couldn't agree more. It's been great diving deep with you.
It's been a pleasure. And to all our listeners out there, thanks for joining us on the deep dive. We'll catch you next time for another exciting exploration.